anything that anyone can do individually to reduce the risk to themselves to transmission is really important for Labor Day, especially as we are getting kids back to school and also post-secondary institutions looking at how to reduce the risk in their own setting. So you cannot hold big parties, gatherings, privately or otherwise. It is the kind of setting, we've heard it from British Columbia, from other provinces, that it's those kind of settings that have contributed to outbreaks.
Canada's top doctor there is cautioning Canadians as they head into the Labor Day long weekend. Dr. Theresa Tam says people need to follow health guidelines, especially while cases of COVID-19 are on the rise in many provinces. British Columbia, for example, once applauded for flattening the curve, now has more active cases than at any point during the pandemic. Ontario has reported more than 100 cases for 8 straight days. And just last hour, Alberta announced a spike of 164 cases in the last 24 hours. Have a listen.
The number of cases being reported today is a clear reminder that we cannot afford to be reckless. COVID-19 does not take holidays, and we have seen weekend barbecues and other gatherings spark outbreaks in the past. I want to encourage all Albertans to have fun while making safety a priority this weekend. Relax, enjoy yourself, but remain vigilant.
That's Dr. Deena Hinshaw. She's the Chief Medical Officer in Alberta. Should we be worried about these new spikes in cases, or was it expected as economies reopen? Is it manageable? Dr. Peter Lynn is CBC's medical contributor. He joins us from Toronto to help us explain and answer some of those questions. Hey, Dr. Lynn, great to see you as always.
Good to see you, Vashi.
Okay, so we all just listened to Dr. Hinshaw say, have fun this weekend while making sure you keep safety in mind. You adhere to safety precautions. Can you help us understand, kind of in layman's terms, and I'm going to admit, I'm confused. Like, to what degree should we be socializing? Should we not be socializing? Should we be staying indoors? Like, where are things at, and how should we conduct ourselves this weekend?
Yeah, and the problem is I think people are using the word reckless, right? So I'm thinking, well, if I get together with my family, that's not reckless kind of behavior. But the problem is we now have asymptomatic people that can produce virus. So kind of think of them like little virus factories that are out there. And so what happens is that they look perfectly fine. So it won't be somebody that's coughing and sneezing and that kind of thing, because those people know to stay away and to stay home. But then unfortunately, what's going to happen is we're looking for that as the person that we should be staying away from, when in fact, it'll be the perfectly healthy person that you go up to and you're at a barbecue. So guess what? Your mask is off because you're now eating food. So we only have 3 layers of protection. One is the mask or a shield. Number 2 is 6 feet apart. And then number 3 is washing your hands so that you don't bring the virus up to your face. So as soon as you remove your mask, we now have to make sure that the other 2 layers of protection are enforced. In other words, 6 feet apart. So if I'm going to be eating at your barbecue and my mask is off and your mask is off, I now need to stay 6 feet apart. However, you look perfectly healthy. I look perfectly healthy. So we're having fun on the weekend. So now we get close to each other. We're talking and we're laughing. And that's where the virus can go across. And then if you're inside, that's even worse because the airflow is worse inside. So at a dinner party, everybody's getting close and everybody is talking. And so now this is how the virus will move around. And then we're going to see a spike going up. And therefore, our concern is that, are we going to have increasing community spread, which then means that we're going to bring those cases into the school? Because remember, they always said that if community spread is low, then the school is safe because there's less chance of people going in. So the same 100 cases in April was fantastic because we're coming downward. The same 100 cases here is that it's going upward. So in April, when the numbers were coming down, every day we're having less and less risk. So when we send our child to school, it's less and less risk because the community cases are going down. In this case, the fire is just beginning to burn. And so now we're heading into increasing cases. So every day we're going to have more cases, therefore a higher chance of somebody bringing the virus in either as a teacher, a principal, school worker, or a child. And so that's why we're concerned that it's in the wrong direction. And so that's why this weekend is very important that we actually do the physical distancing and all those things again.
So if I read you correctly, if I interpret what you said correctly, it's okay to have, let's say, your family over, but you've got to adhere to the sort of the precautions that we now are familiar with. You've got to wear your mask, you've got to wash your hands, and you've got to stay 6 feet apart, at least, a combination of those.
Yes, and all three would be the best situation.
Right.
And the key thing is that we used to be sort of lulled by the number. They said, oh, it's a 10, 20 or whatever the number is. But let's say all 10 people stand next to each other. Well, that's not going to work, right? Similarly, if you had 20 people, but everybody distanced themselves, that's actually a safer situation. So whenever we give a number, then everybody says, oh, I only had 10 people, but then we all sat together and we watched, TV or whatever it is. And so therefore your risk increases in that fashion. And for people that, don't want to wear a mask, you can wear a face shield or anything like that. That'll do just the same. Because remember, the purpose of the mask is to slow down how far the virus can go. So in other words, it protects you. If I have virus and I'm the one that looks healthy and I'm producing virus, it stops me from spraying out the virus when I breathe out to 2 or 3 feet. Instead, it keeps it around 2 or 3 inches in front of my face. And then what happens is that I could protect myself as well, because if, let's say, there's a virus floating around, because I have the mask material, it's harder for me to suck in. So I have to physically be closer to the virus before I can actually suck it in. So a mask actually protects in both directions. It stops me from moving the virus outward, but it also stops me from sucking in a virus if I don't have a virus. The face shield does the same thing. So in other words, it stops you from blowing it out directly at people. It'll deflect it downward. And number two is it's very hard for me to suck in a virus. It has to make a U-turn around the face shield before it gets into my mouth. And that's why that works. And then the 6 feet just makes it harder for the virus to get across to you. And then the washing of the hands stops you from bringing viruses that you might have touched up to your face and then therefore breathing it in. Because remember, the virus still has to be breathed into your lungs for it to actually take hold.
So how does that mask explanation that you gave, and forgive me if I turn bright red or I can't get through this without cracking up, I hope I can, but the big headline this week was from Dr. Tam talking about wearing a mask during sex. I mean, I don't think I saw an article go more viral in this country than this week. Can you explain to us the thinking behind that advice?
It's a hot topic, right? You got COVID and you've got sex in the same sentence. And so definitely, I'm a big proponent of masks, except in this situation, it may not work the way we're thinking, right? So remember what masks do, the porous mask, in other words, the non-medical mask, basically, it slows down the wind power. So therefore, the virus cannot move out as far, but it will move out because the material is holy. So therefore, the virus can get through when we're breathing. However, when we're close in an intimacy situation, we're within that 2 or 3 inches with each other. So therefore, if the virus is only going 2 or 3 inches out, I'm still within that breathable space. So that's why I don't think the mask is going to have as great an effect as it has in schools and things like that, where you're stopping the virus from moving to the next person who's maybe 2 or 3 feet away. So that's why I think we should go back to a couple basic things. Number one, you should know the risk of the person that you're going to be with. In other words, are they a traveler? Did they just come back from the United States? Did they work in an assembly line where there's no separation? So therefore, a sick person could infect them. Are they taking risks? Like, for example, the karaoke bar, where they pass around the microphone. Are they like that? Or do they wear a mask all the time and they wash their hands and they wear a shield? In other words, know your partner so that you understand what is their chances of getting that particular virus. And then you can protect yourself accordingly. And then there's lots of recommendations about no face-to-face. So you do wear the mask, but you try and do things without face-to-face. I'm sure people can get very creative about what they're thinking about. So therefore, no face-to-face contact. And then the rest of it, you guys can be imaginative, as they were saying. And then finally, there will be in the future
just a warning, I have only 30 seconds left of the show. If you don't mind wrapping up,
okay,
I'm sorry.
So quick test. There will be a quick test in the future where we could do it either by saliva or whatever, and therefore we could just show each other our COVID test, and then that'll be okay. It used to be HIV test, but in the future we'll have COVID tests, and then hopefully the intimacy will still come back so that we don't have to keep doing these kind of silly things. We might be able to have a test in the future that you and I can do at home, for example.
Okay, well, no better professional than you, who got through that whole thing without cracking even one smile while my face became very red. Thank you, Dr. Lin. Great to have you with us as always. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.